Welcome to Deuk Spine Institute, and this is our last surgery for today, November 21, 2023, just a few days before Thanksgiving. And our last patient here has not pain from the disc, but pain in the facet joints. So the disc is the most common cause of chronic back pain. The facet joint is the second most common cause of chronic back pain. His back pain is on both sides, and it's from around L3 to S1. So he's got 3 facet joints on the left, 3 facet joints on the right, causing his pain. We're going to start by numbing up the skin, and our patient is sedated. We're keeping him comfortable. Shot. We're going to do an injection of the skin with some numbing medicine. Then I'm going to place a needle. Sorry, everything's okay. You're doing great. I'm going to place a needle down to the spine, and I'm going to inject some numbing medicine down there so that it's a little more comfortable for him to have this procedure done. Shot. Okay, and you can see right here that our needle is right over the L4 transverse process. So if I went straight down, it would be a perfect shot to the L4 nerve that we need to treat. Okay, so I'm going to numb things up. Just to make it more comfortable for him. I've made an incision. The incision is about 3 millimeters in the skin. We're starting on the left side. Any questions, Sanjay?
No questions.
All right, so Luis, good job. Using the skin traction technique. Shot. Perfect. You can see the tip. Jordan, show the audience how the tip of the probe is sitting right over the transverse process. Exactly where we want to be. Our target. Shot. Okay, we're literally perfect. Exactly where we want to be. And this is where the pain nerves run. Shot. So that's one down. And we're going to move on to number 2. Shot. Perfect. Right where we want to be for number 2. Shot. That's like right where we want to be in that corner there. Right where the transverse process meets, shot, with the superior articular process. Shot. Shot. All right.
We have a question from Samir on YouTube.
Hold on. I am not going to take a question yet. Let me just get situated. Shot. I think that looks pretty good. It's just, he's got a little bit of abnormal bone right here. I feel like I'm sitting on the TP right now. I could see that. Yes, I'll take the question from Samir.
Dr. Deuk, does Sigma cover this surgery? I have a good plus plan.
Does Cigna cover this surgery? So, Samir, the problem is we don't have a contract with Cigna. So they may cover the surgery, they may not. We don't know because we don't have a contract with Cigna. My advice is get it done. We'll bill Cigna. If they don't pay, we'll fight them. But in the end, you want to have a pain-free life. And, you know, I wouldn't make decisions about what's best for your health based on what your insurance covers. I know it's important for all of us to try to get our insurance to pay for our medical care. But in the end, what's more important than money is health. And living in pain every day is not healthy. It's just not. My advice is get it fixed properly, whether or not your insurance covers it. Shot? All right, so I'm trying to find where the transverse process meets the superior facet. I could feel it with the tip of my probe, but you have to be very certain where you are. If you're not very certain, there could be problems that occur as a result. The biggest problem is you may not get rid of the patient's pain. Right, Jordan? I feel bone here. And by the way, if you're doing these types of procedures, you always want to feel bone. You should always feel the bones. You have to sit on top of the bone. That's what this procedure is. Literally, you have to put your probe exactly, Shant, on top of the bone. If you want to have a chance of, getting rid of the pain. So you got to feel with your fingers. And that's what I'm trying to do right now. See, that's a transverse process right there. You want to be killing the pain nerve right in that area. Do we know which side was worse for him? Left or right? So to the Cigna question, I'm sorry I don't have a better answer for you. But the reality is we don't have a contract with Cigna. Shot? And so anybody that has Cigna will take the insurance, will bill it, but we don't know if they're going to pay until afterwards. So we may get surprised and they don't want to pay. And of course, you can't run a business without getting paid. So typically what we do for Cigna is we will take some money from the patient before the procedure, and then we'll bill their insurance. And hopefully they'll pay. If they don't, we'll fight. Send them nasty letters called appeal letters and tell them they need to pay. I'm very happy with the position. Could be a little bit more north. Shot? I mean, I can't imagine getting better than that. That's pretty darn good. Yeah, I think we need it. Yeah. Go ahead and prep it. Great questions so far. Now we're going to move to the other side. We've done the left side. I'm going to do the right side. Num num. Shot. Look at that, perfect position at L4. See where the needle tip is on the x-ray, folks? That's exactly where we want to be. You can't do better than that. Yep, everybody wants me to fix their insurance. And I tell them, listen, I can't fix insurance. I can fix your spine, but I can't fix your insurance. Unfortunately, insurance companies are in the business of not paying for people's medical care. So the more chances they have of not paying, they're going to take those opportunities and not pay, because that's how they make their money. At the end of the day, yeah? That's what I thought. Shot? Thank you. Thanks for getting that information to me. Yeah, we at doctors and hospitals don't like insurance companies. And for those of you that are interested in the insurance situation, there is an increase over the years of what are called denials, where the insurance companies are not paying for needed medical care for patients. Their premiums have gone up, so they're charging you more, but they're paying the doctors and hospitals less. And hospitals are literally going out of business because of it. It's in the news. As a matter of fact, if you go to the Deuk Spine Facebook page, I'm always posting stories, news stories, about how hospitals are fighting the insurance companies, how they're getting paid less and less. Medicare Advantage is a big one. Medicare Advantage is the insurance company's plan, Medicare plans, and what they do is they basically take money from our government for every Medicare patient, and then they take that Medicare patient, put it in their pool of covered lives, but then they don't pay for the medical care they need. So when the Medicare patient goes to the hospital and needs a kidney stone fixed, they're going to say, oh, that's experimental. You know, getting rid of kidney stones is experimental. You don't need that done. It's not covered. And they send these nasty letters to the hospital and then to the patient where it says, we're denying your treatment because it's experimental. Because getting rid of kidney stones is experimental. Oh, this is happening all the time.
You have to be careful. Parasite shouldn't kill its host.
Yeah, you're right. Parasite should not kill its host. But denials are at an all-time high in medicine right now, where insurance companies are denying more treatments than ever before.
It's a very poorly regulated field.
It's not regulated. That's the problem. The government doesn't regulate it on purpose. The insurance companies don't want regulation.
And they have strong lobby groups that fight every bit of bureaucracy.
They have more than lobby groups. The insurance companies run the government. They literally run the government. Shot? Right, and who makes the checklist? Yeah, of course they do.
There's no benevolence in it. There's nothing benevolent about it.
The insurance company makes a checklist of what's covered, and then they have people like you denying it. How did that make you feel?
Luckily, as a nurse, I couldn't deny. I could just collect information and forward it to the physician for them to deny or approve.
When was this?
Forever, I worked there about like 4 years ago.
Nowadays, nurses are denying.
Oh, really? They can?
Uh-huh.
Oh, wow.
You gonna go back?
No. I don't want to get yelled. I don't think nurses should be able to deny.
Yeah, I agree.
But you're not denying, right? You're just following the guidelines.
Yeah,
So the insurance company just says, hey, you're not denying, you're just following the guidelines.
you read if they like check, okay, approved. One thing they don't need to deny.
Yeah. So that's how they're making their billions of dollars in profits, is by denying. All right, I got one more. Huh?
They used to do that for us in Las Vegas, taking birthdays and stuff. You know, so you don't have the patient's right birthday, it's not. You got the patient's right birthday.
Yeah, they do that all the time.
That's all.
We've seen Medicare deny, saying that you didn't put the name on, they're exactly on the line, on the form. Like literally a millimeter above the line. And they deny.
Let's see, I have all the right data, it's not the right location.
No, they'll tell you incomplete data. And then you're like, well, what's incomplete? I don't see anything incomplete. They literally have what are called denial codes where they are nebulous. Do you understand what I'm saying? They literally will not tell you what you did wrong. They want you to figure it out. Because that's part of the game they play. Horrible. Horrible. How much hospitals are getting ripped off by the insurance company. Huh?
I got charged for extra things I never had done.
Oh, really?
Yeah, extra ID. Cost like $32. And I was
You
like,
never had it.
I had one ID place. Don't charge me for the second.
What procedure did you have?
I just went to the ER because I was having like stomach pain. And I was like, I need to
So
bill
they
it.
charge you for things you didn't even have.
Yeah, but were you at any point asleep?
No,
Never.
fully awake.
Interesting. Well, it's not like the hospital did it. Somebody made a mistake, right?
Yeah, so I had to like literally get a printout of everything because you just have to make sure.
All right, I think we're done.
Extra ID, check that out.
Yeah, exactly.
All right, I think we're done. I feel good about it. This right side is a bit unusual, but I think we've got it. Let me see. I just want to do one more right there. All right, well, hopefully that does it for this patient. Good job, everybody. We're all done. And you can see the whole surgery was done with 2 3-millimeter incisions. So, any questions? Yeah.
No questions.
Have a wonderful Thanksgiving, everyone. Thank you all today. Great job, Luis. We'll see you all tomorrow for the Thanksgiving lunch. If there's no questions, you can end the broadcast.